Hello. Chronic exertional compartment syndrome usually responds well to surgical management, but there is high variability in the published outcome data. There are no universally agreed diagnostic criteria, although the clinical components of the history and the need for compartment pressure testing is well recognized. We feel that the variation in outcomes for CECS likely represents patient selection errors and diagnostic uncertainty. We sought to evaluate which of the previously hypothesized diagnostic criteria actually correlated with a good outcome from surgical fasciotomy. We then sought to produce easy-to-use guidance for clinicians to help them offer the correct patients fasciotomies. This was a retrospective cohort review of 28 patients who had been seen in our CECS clinic and undergone dynamic compartment pressure monitoring. Dynamic pressure testing involves the insertion of a pressure catheter into the suspected compartment, and real-time pressure is measured over 10 minutes while the patient walks, jogs, or runs. Static measurements are also taken before exercise and 5 minutes after exercise finishes. Patients were given a questionnaire that asked them to rate their symptoms on a visual analog scale both before and after fasciotomy. Certain aspects of the demographics and the analysis of the dynamic pressure testing were compared using correlation coefficients with the percentage change in their reported symptoms. 5 of the measured components had a positive correlation. The strongest correlation was found with the area under the curve of the dynamic pressure trace, equivalent to the cumulative pressure experienced throughout the period of exercise. Other aspects of the history and dynamic trace were also important. We synthesized these into a weighted score, with a weighting of 2 assigned to those aspects that had a strong correlation, and a weighting of 1 provided to those that had a moderate one. Linear regression analysis showed that this score had a good predictive value. Further, correlation analysis showed that having a score of 4 or more had a very strong correlation with good surgical outcome. We feel that our data shows that good outcome after fasciotomy is predicated on having a clear history and positive pressure studies. Further, we feel that the use of the COSY score provides an easy synthesis of the predictive measures of the history and pressure studies to guide the use of fasciotomy. However, we accept that this retrospective study of a small cohort is not fully predictive, and further high-quality prospective work is required, and we have begun this. Thank you.